Just released and now streaming for meetings by mail, the Cleveland Clinic Ultrasound course, integrating POCUS into your practice. Worth 11.5 AMA PRA Category 1 credits and applicable as MOC for ABIM and ABA. Also accredited for nurses and physician's assistants. This didactic primer will provide all healthcare practitioners with foundational skills and state-of-the-art techniques for point-of-care ultrasound. Multiple workshops will rapidly develop diagnostic and guiding procedures that capitalize on ultrasound's multifaceted utility. Topics include building a POCUS program, ultrasound basics for thyroid, neck, DVT, aorta, cardiac, trauma, lung, rush, shock, paracentesis, thoracentesis, soft tissue aspiration, central venous access, and much more. Let's take a closer look.
The first and foremost thing that we have to find out when you are doing lung ultrasound is where is the pleural line. Don't start lung ultrasound without identifying the pleural line. So there are two images. What we are looking for is this arched appearance of the rib followed by a rib shadow on both sides. And then what you will see is a hyperechoic line that is kind of 0.5 to 1 centimeter below the rib. And that's what we call the bat sign. So you have rib right here, pleura, and rib shadow, kind of appears like a bat. It's all about visualization. But most important thing is identify your ribs, identify your rib shadow, and then identify your pleural line.
Obtain foundational skills with this primer for point-of-care ultrasound. The Cleveland Clinic Ultrasound course, integrating POCUS into your practice, is available now at meetingsbymail.com.